What we've done is that we've concentrated on real people's lives and taking steps to improve the quality of life for people and their standard of living. So with this, a very strong emphasis within our proposals on things like housing, on health, on cutting the cost of living, and tackling all of those issues that really eat into the family budgets. So things like, childcare costs, public transport costs, health costs, all of those issues. We want to reduce those. We want to introduce really good quality public services that people can depend on and reduce the charges that people have been faced with in recent years. And we believe that that's the best way to help families.
Basically, the whole idea of people stretching their incomes further. And you can stretch your income further if things don't cost as much. And some of the things that really are eating into people's pockets are the cost of, for example, shelter. If housing in the broad sense is not the key issue in your budget in the middle of a housing crisis, there's something wrong with the proposal. So we intend to stretch the budget further than government. And in fact, looking even at the rainy day fund, you can't look at this budget as a one-year proposal because it takes time, obviously, to build houses. So we need to scale up the amount of housing that you build, and that's one of the things that we have put as centre of our budget proposals this year.
Correct.
Well, we've said from the beginning that it's really important not to erode the tax base. I mean, if you start cutting taxes, then government has to cut services, and our services are weak enough as they are. And what we're saying is that, it's much better for society, much better for individual families if we invest in public services so that people can depend on the health service, that it's there available when they need it. If we invest, in housing, obviously, and reduce the cost of rent, reduce the cost of mortgages, that's a huge help to families. If we can, target areas like childcare so that childcare costs less for families, that's a much more sustainable approach rather than just cutting taxes, because cuts to taxes will inevitably lead to cuts in services.
Well, we're proposing 500 million additional over and above what the government would be proposing for housing. Because it's the number one issue at the moment and it needs to be front loaded, so we need to build more houses. We also need to have measures that will tackle things like, for example, vacant houses, vacant sites, so that it makes it unattractive for people to hoard land, and that there is something punitive there, because I think it's in all of our interest that happens. We also think that the relationship between, the relationship in relation to land needs specific measures, and we have some proposals in relation to our relationship with land, including looking at the constitutional issues around land. We're proposing a rent freeze, and in actual fact, we think that should happen for a number of years because we're in this crisis scenario. And essentially, when you're in a bad situation, the one thing you don't do is make it worse. By not taking measures now, we're actually making it worse. First of all, we're saying that all developments should have 20% affordable housing. But we're also saying that state land needs to be treated differently from that point of view. It needs to be a much higher percentage that are affordable. And essentially, when we're talking about affordability, we're not talking in the same terms as government are talking about, where they see, houses of 320,000 as affordable. That means that you have to have an enormous income to actually afford a mortgage. That isn't affordable in most people's terms. In a couple with two modest incomes should be able to be in a position that they would be able to afford to house themselves, and that's not the case at the moment, and that's what we need to be talking about in terms of affordability.
We now have a plan there in terms of Sláintecare, a plan for a universal public health service, and also a service that ensures that most of the services are provided locally in the community, and that's the way to go, and there is cross-party support for that, and the government would be very foolish not to go with that plan. They've announced an implementation plan, but they haven't announced any funding allocation. And what we're saying is that it's really important that this year we start the full implementation of Sláintecare, and that means providing the funding that is set out in Sláintecare so that we can start reducing the cost of accessing healthcare, because cost is a huge barrier for most people. And what we're talking about is making an allocation so that we can reduce prescription charges, we can reduce inpatient charges in hospitals, we can ensure that we have an adequate number of primary care staff, so we don't have these long waiting lists for children to access things like speech and language therapy, or older people to access physiotherapy. Those waiting lists are completely unacceptable, and we have to provide the funding in order to ensure that we have sufficient staff at community level so that people can access those services within a reasonable period of time. The other thing we're saying is that we're providing a figure of €500 million in our alternative budget for investment in capital projects within health, because over recent years, we've failed to invest adequately in those capital projects, things like primary care centres, additional hospital beds, the need for diagnostic services in the community, all of those kind of things, the need for an e-health programme to ensure we have proper technology and so on. So we're saying that there's a need for that catch-up fund. It's called a transition fund in the Sláinte Care programme, and we're allocating a figure of 500 million for that, because we believe Sláinte Care is the only game in town. That is what is required in order to tackle the long waiting lists and ensure that people have early access to good quality public health services.
Well, essentially, because we're social democrats, we believe in intervening in a very direct way, and essentially levelling the playing pitch. And essentially our focus of attention is on affordable lives, and the quality of somebody's life depends on being able to manage their money, being able to stretch it further, and that's really what we've been aiming to do with many of the proposals that we've put forward as our alternative.
Our ultimate aim, I suppose, is to improve the standard of living for everybody, for all households. And we believe that by far the best way of doing that is by investing in good quality public services. I mean, the model is there from the Nordic countries. There is a social contract that operates in Nordic countries where people pay a fair share of tax, and in return they know that they have access to really good quality public services. And we should be taking the same kind of approach, and that's the most sustainable approach too. And it means that it ensures that families have that kind of security of knowing that when they need to use public services that they are available to them and that they're affordable. Because at this stage we know that in this country the tax base has been eroded. We know that through the austerity years there's been huge cutbacks in all of those essential public services that people should be able to rely on, and those services are not available. So what we're saying is it makes sense from everybody's point of view to leave the tax base as it is and to use tax receipts in order to invest in those public services. Because the kind of approach that the government is taking, where they're promising tax cuts, that will inevitably lead to cuts in public services, and we simply cannot afford those. So it's about having a cohesive society, having good quality standard of living for everybody, and learning from those models in other countries where we know they create successful societies and successful economies.